Hello, I'm Giovanna, International Clinical Manager from Vinci Medical. In this presentation, we're going to talk about IPL. First, the science and the technology. Here we have the timeline of IPL. It starts in 1995 with FDA approvals for vascular lesions. In 2003, it has another approval for pigmentary lesions and skin rejuvenation. It's a high flexible system, and you're going to see during this presentation that it's very efficient and safe. The difference between laser and light is that laser is collimated, monochromatic, and coherent. And light is divergent, it's incoherent, and have a wide spectral range, a lot of colors. All these colors are related to a wavelength. And IPL goes from 400 nanometers to 1,200 nanometers. When the light gets to the tissues, it has interaction. This interaction could be photochemical, photothermal, or photomechanical. Photochemical, it works more biostimulation, and we can have this when we're working with LEDs or low-level lasers. Photothermal is more common, and we can have this when we're working with IPL and lasers. We can get coagulation or vaporization of the tissues. Photomechanical is work with disruption and no heat, and we can have this when we work with Key-switch lasers. In our Etherea, it happens when we work with our acroma. IPL, as I already told you before, works with photothermolysis. But when we're going to treat active acne, for example, we are going to work with photochemical interaction too. Here we have the absorption curve, and we can see here in brown line, melanin, in red line, hemoglobin, and blue line, water. As I told you, IPL works with 500 and 1,200 nanometers. So it's going to work with melanin and hemoglobin. At the end of the spectrum, we can have absorption from water, but just a little, not too much, okay? Because the absorption from melanin, when you're going increasing the wavelength, it goes more deep, okay? But it happens until 1,000 nanometers. After that, we are going to have absorption from water, so it's going to change, okay? And because of that, filters with shorter wavelength are more superficial, and those with longer wavelength are deeper. Here we have just a quick review about the indications, the chromophore, and the wavelength. We are going to see this better during the presentation, okay? As I told you, it's just a quick review. Another thing that you need to pay attention is the thermal relation time, or the TRT. The TRT is the time that the chromophore takes to lose 50% of the heat that it absorbs during the treatment. And it's related to the pulse duration. Here, another quick review, but in this we can see the structures and the TRT. As we can see here, it's the TRT changing according to the size of the structure. So it's important to take this in mind, but as I told you, just a quick review. For IPL, it's very important to care about the fit spectrum. Okay, the skin type changing. The skin type is very important when you're going to choose our IPL, the filters, okay, and the indications. For example, to treat phototypes 1, 2, and 3, IPL is very safe. To treat 4, we need to pay attention, but we can treat. 5, more attention, but we can treat 2. And 6, there are some treatments that we can do. For example, active acne we can treat, or skin rejuvenation we can treat. But for example, hair removal we need to avoid, okay? But skin type is different from tainted skin. And to work with IPL, we need to avoid the tainted skin. And talk about our IPL, the features and the technologies. Our IPL works with 6 filters and pulse duration 5 to 100 milliseconds. We can be more aggressive or less aggressive, changing it. The filters are plug and play. We have sapphire contact cooling, and with this sapphire, we can change the temperature according to the treatment. Normally, we suggest to use 5 degrees always, more cooling, more safety, more comfort for the patients, okay? We can work with the biggest sapphire, as we call, 40 to 12 millimeters. But we have 2 vascular tips, a round one with 80 millimeters and a square one, 12 to 12 millimeters. It's very good when you're going to treat localization lesions. For example, a melanoma, we can put just in this lesion, and with this we can make all the skin safe and get the aggressive treatment only in the lesion that we want to treat. Our IPL works with square wave pulse. This square wave pulse and maintain the fluence the same during all the shot, so it gets safe and guarantee that we are going to work with the energy that we put, the fluence that we put, okay? No change during the shot. Here we can have the screen. And the screen, we can see the filter, the contact cooling. 1 is corresponding to 20 degrees and 5 corresponding to 5 degrees, okay? 5 lights, 5 degrees. We have the pulse duration, the fluence, and the frequency. And talking about carrying and maintenance about our IPL. It's very important to checking and clearing the filters during the proceeds. Normally, we just recommended to use alcohol, okay? Okay, we can see here some damage in the filters. It's very important during the treatment. If we saw this, we need to call the assistance, okay? IPL have a range of 6,000 light pulses, okay? After that, just needed to change the light. In the vascular tip, it's very important when you are working with it to check the cooling during the treatments. We have more about the clearance and the maintenance in our YouTube channel, but it's possible to see these videos in our site too, okay? evidenceLaserAcademy.com. Talking about practice and clinical treatments. Here are the indications of IPL. We can use for rejuvenation with collagen stimulation. We can use for pigmentary lesions as melanosis and the pellids. We can work for vascular lesions, especially the superficial one, okay, where it's not possible to treat vessels on the legs or deep vessels, just superficial. And we can work with hair removal and active acne. And we can use for another indications as psoriasis, vitiligo, and red stretch marks. It's very important when we are going to work with extrafacial areas to pay attention with the tainted skin, okay? Normally, especially in regions as here in Brazil, that we have a lot of summer, so the patient sometimes doesn't use sunscreen in the legs. So when you're going to treat legs, for example, or arms, we need to pay attention on that, okay? Let's start to talk about all the indications. First, hair removal. We have 3 filters to work with our IPL to hair removal. We can use 580. 580 normally we use for thin hair, especially that is in the face, and for the types 1, 2, or 3. We have 695. This wavelength we normally use when the patient has dark skin or thick hair or deep hair. And the others, we're going to use 640, okay? It's very important when we are going to use our vascular tip to increase 1 joule or 2 joules during the treatment, okay? 1 joule for square one and 2 joules if you're going to use the round one. For hair removal, normally we use the square, but it's very difficult to use the round, but it's possible too. So to hair removal, it's important to work with 5 degrees. And as I told you in the beginning, more cooling system, more comfortable, more safety to the treatments. Number of sessions, 4 to 8, and it's going to be separate in 30 days or 6 days. And normally the hair takes some time to get out of the skin, okay? So it's around 10 to 15 days. And there's no downtime. Of course, right after the treatment, sometimes you can have edema and erythema, but it's only right after the treatment, okay? It's going to reduce occurring about 1 hour or 2 hours after treatment. Talk about pigmentary lesions. It's very, very good when we're going to treat melanosis, okay? We can use for hypopigmentation, and we can use for infraoral pigmentation too. But I think the most important indication here is melanosis. As you can see here, just before and after 2 sessions, we have this result. Here, this pictures is before and right after the treatment. As we can see here, the lesions get more appearance. So if we don't talk to the patient, maybe the patient could think, oh, it's worse. But it's normally to happen this way. We can use 2 filters here, 540 and 580. Normally, 540, we are going to choose when the patient has phototype 1, 2, and 3, and the other 580, we are going to choose when the patient has phototype 3 or 4, okay? And we can change this according to the lesions too. The level of the cooling system always 5, okay? Number of sessions 2 to 4, and the time between the sessions could be a month, okay? And normally it takes some time to be good. So as I told you, it's gonna look like worse and the day before the treatment, and takes some time. So normally we can see 15 days after the treatment, we can see the result. For vascular lesions, it's very important to notice that IPL we can use just for superficial vessels, as we can see here in the nose, okay? And we can work with IPL for rosacea too. It's very good result. We have good result for rosacea. Poikiloderma, okay, and red stretch marks, or mines, and a lot of indications. We can use 3 filters here: 515, 540 for clear phototypes, 1, 2, 3, and 580 normally for high phototypes or deep lesions. Okay. It's very important when we're treating vascular lesions that the time of shot or the pulse width, it's gonna be changing according to the size of the vessel, okay? If the vessel is small, we are going to work with 10 milliseconds, for example. If the vessel is large, we're going to increase 15 or 20 milliseconds. It's very important not to press the vessels during the treatment, okay? And if you have pigmentary lesions or hair at the same place as the vascular lesion, we need to remove them before to treat the vessel, okay? As we can see, we are going to use the same wavelengths to treat pigmentary lesions, for example. And pigmentary lesions are superficial to the vessels, so we can burn the skin because it could be too much energy for pigmentary lesions, for example. We are going to see that we have indications of the parameters, and the indications change for pigmentary lesions. We are going to use low energy than normally we use for vascular lesions, okay? So it's very important to pay attention in the region that we're going to apply our IPL. As I already told you, it's for vascular lesion, we're going to use just in face or neck or chest. And for legs, we can't use IPL. Okay, for legs, we're going to use our 1064 long pulse. For poikiloderma, it's very important to divide the treatment. Normally, we start to treat the pigmentary lesions in the first session. At the second session, normally we start to work to treat the vessels. But normally after 3 treatments, we can use together with collagen stimulation. So we can use 6095 before, and right after put 5040 or 58 nanometers, okay? So normally we increase the number of sessions to treat with not too much aggressive treatments. We are starting cleaning the superficial, that is the pigment. Then we are going to treat the vessels, and then we're going to stimulate the collagen, because we know that stimulating the collagen, the appearance of the skin is going to be better. If we decide to put together 2 filters in IPL, always we are going to start with the deeper one. So in this case, if we're going to treat this kind of chest, we need to start with the deeper for collagen stimulation, 690 or 640, and we can put right after 540 or 580, okay? It's very common to do this combination to treat phase 2 for rejuvenation. So for vascular lesions, the cooling system always in the maximum. Number of sessions, it's going to change, but normally 2 to 4. For poikiloderma, we can increase this to 6, okay? And between the session, we're going to wait a month or more. And Normally, after 7 to 40 days, it's possible to see the result. Okay, and the downtime is just a little edema and more erythema right after the session. Okay. Here we have a result after 3 treatments. This picture is from Dr. Celia Khalil. It's just to see how better it is with only one filter. She used just one filter and 2 sessions. Talk about active acne. For active acne, here we have a result after 2 sessions, okay? And normally we put together 2 filters, 6-4 for inflammatory effect and 400 to get the to active the porphyrin, okay? So the 400 gets the blue line, the blue, so the blue light, I'm sorry, if the blue light is going to work with the porphyrin of the acne, okay? So it's more bacterial effect. Putting them together, we're going to have good result, fast result, but it's necessary to put something together if it's necessary, these results getting maintenance, okay? Because it's good, it's fast, but if we stop to do it, maybe it can goes back. So always work with 5 number of session. It's depending, but maybe sometimes just 1 session, or maybe we can go to 10 sessions, no problem. And here the time between the sessions, normally we work with 7 days to 15 days. Okay, we're working with bacteria, so we can't put too much longer. And normally the result is immediately. It's the day right after the treatment, we can see the improvement of the lesions. And normally we work with low energy and long pulse, so there's no downtime. And about talking about skin toning and aging. Here we can see a picture after 2 treatments, before and after 2 treatments, and we put together with this retinoic acid, so it's possible to use drug delivery too. We're going to talk about this later. And normally we put more than 1 filter together with the treatments. We can, normally IPL is very good when we have association of pigmentary lesions or vascular lesions, and we want to stimulate the collagen. So we can do as the same I told you before for the decollage. So we can put here, start with 540, for example, to clean the skin, and right after the second session start to improve the collagen, okay, with 640 or 695 nanometers. To stimulate the collagen, the deeper is better. Always cooling system in 5, number of session 4 to 6. The interval between the treatments could be 20 to 30 days. And normally after 15 days, we can see the improvements. And other indications and off-label use as drug delivery. Drug delivery, it's very common here in Brazil, okay? When you're going to use IPL, just 15 to 30 minutes after IPL, it's gonna be better to do it. So use it to put right after the treatment, okay? We can use, here in Brazil, we use vitamin C, retinoic acid, and we have good results. In this case, for example, to treat keloid or hypertrophic scars, Dr. Celia Khalil put a lot of things together and the results were very, very good. Let me show you. Here and before and after 4 sessions. And here we can see the treatment that she used, IPL, with a lot of things together, but the result for session, as I told, very, very good. Thank you.